Kentucky Health addresses modern medical topics from across the Commonwealth and surrounding states. It was created by Louisville surgeon Dr. Wayne Tuckson through the African American Health Initiative. This program is funded in part with a grant from Kentucky One Health.
Just as it takes a village to raise a child, it takes a team to repair a smile. Not too long ago, a young friend of mine had an injury to his mouth, broke a couple of teeth. On the surface, it doesn't seem like a big deal, but without the ability to smile, he was very conscious of this. And what we did, we had several good people here in the Louisville community who decided to take care of him. And through this, we can see what happens when we have trauma to our mouth and we break our teeth. First, we're going to start off with what goes on at the very beginning. And with us is Dr. Ken Livesay, who is an oral maxillofacial surgeon with East Louisville Oral Surgery. Dr. Livesay, thanks for being with us.
Thank you.
Now, Ken, let's start off by looking at what the problem was to begin with. Now,
Sure.
when James shows up, what do we see here in this picture?
So James presented, he lost some front teeth, and we look at different solutions to try to replace it. Replacing teeth is kind of a difficult dilemma because not only do they lose teeth, but they also lose surrounding structures, bone and gum tissue. Teeth is a dynamic situation because we use it probably more than any part of our body. We use it to speak, and we also use it to function in terms of chewing. So we have to look at it's a three-dimensional problem. We have to reestablish and reconstruct the missing bone and tissue and then replace the teeth.
I hadn't thought about it like that. So, you know, it also helps, I guess, facial structure, too.
It does. When, you know, as we look at the elderly population, as they age and they miss teeth, you see a lot of facial droop and their jaws sag. And so not only is it a cosmetic issue for these folks, but certainly a functional. So, yes, it does support the underlying facial structures.
Now, James had a couple other things going on with him, too. I think, what do we see here in this picture?
So in this picture, James has several what we call avulsed teeth, where he lost his teeth in a traumatic accident. And so that's showing that he's been missing 3 teeth there. And then he had some other areas of concern, some known to him and some not. He had some impacted wisdom teeth that were going to present problems for him in the very near future. He had some broken teeth that he had previously tried to fix with root canal therapy, which took care of his pain, but he also, the teeth were weakened and fractured as well. So he had multiple other issues taking place at the same time that some of it he was aware of and some of it wasn't.
Now, see you using the standard tool here, that mirror in one of the pictures. But what other things do you use to try to evaluate your patients?
Yeah, there's a lot of tools. First of all, we talk about, you know, what was your bite and smile like before the accident. So we like to kind of get a feel of how his teeth were positioned in his arch. Mm-hmm. We look at the gum tissue with clinical exam. We look at the tongue and the supporting structures. We check his bite. Mm-hmm. We take a series of dental films. We sometimes take just individual tooth x-rays. We'll take a panoramic film, which shows all the structures, jaw joints, sinuses. And then oftentimes in trauma, as I mentioned earlier, they miss bone support. So to take the one step further in the diagnostic workup, we'll do a CT image, and we'll do dental CAT scan images, which gives us 3-dimensional images to look at the bone width and height and the supporting structures.
So what are we seeing on this picture then? When we look
so on this picture, there's a lot of things going on. In the mandibular anterior area in the front, that's from the trauma, and what we see is some fresh healing extraction sites where he lost his teeth. Mm-hmm. In the posterior areas of his mouth, he's got impacted.
So that's going to be on, and when we're looking at this picture, then on either side is going to be posterior. Then.
Correct,
okay.
Yes. And so he's got these wisdom teeth that are coming in at very steep angles into the other teeth,
wow.
which causes periodontal issues, gum and bone problems, mm-hmm. which actually can cause him to lose the teeth in front of the wisdom teeth. Ah. So one of the main benefits of getting the wisdom teeth out is to support the teeth that are already erupted, the teeth that he's using in his mouth. So he's got 4 impacted wisdom teeth, and then also there were some broken teeth in the upper arch as well that needed to be addressed.
A lot of hidden problems going on in that mouth.
There sure were. And like I said, some of it he was aware of and some of it he wasn't. So that's the benefit of routine dental visits, is to keep up with little problems that maybe be small at some point, but escalate into bigger issues.
Now, let's jump to, so what are you going to do to try to repair this? You have to remove those teeth that are bad. You talked about removing the wisdom teeth, but now you got these defects in the mouth.
That's right. So once the teeth are gone, the next step is we'll do a good exam and we'll make some molds of his mouth. We'll make some models and we'll pour these models up so we can check his bite, see how much room we have in terms of spacing on what can and can't be done, and then we'll take a three-dimensional CAT scan. If the patient presents with adequate bone and soft tissue, then we're ready to move forward to replacement teeth. If he does not have adequate bone and soft tissue, then that's the first step, is to reconstruct what's missing.
So how do you go about doing that? I've heard these things, implants, what have you?
Right. So if they're missing bone, there are several bone grafting techniques we can use. We can harvest bone from some other place in the mouth or in the body. We'll take bone grafts from their chin area. We'll take bone grafts from wisdom tooth areas. Large defects, we'll take bone out of hips and out of tibias. We reconstruct the area with the bone graft. We'll take soft tissue from the roof of their mouth and preserve that area and support that area so that we can accommodate the dental implants. Dental implants now have been out over 40 years. Success rates on implants are 95 to 98% successful. We've got long-term 20 and 30-year studies that demonstrate these success rates. A dental implant is a titanium screw or a post that we can insert in the jaw surgically, very simply, that replaces the missing tooth root of a tooth. So when we talk about dental implants, there's essentially three parts. The dental implant is the titanium screw or post that we insert surgically in the jaw, and then there's a healing period to allow the bone to integrate into that implant. And that term's called osseointegration, where bone integrates into the implant. Once that healing has occurred, then we add a second structure to the implant. It's called an abutment. And an abutment is a connecting piece that brings the implant through the gum, and then that allows for the third part, the general dentist, to reconstruct the tooth missing portion. So then they'll start to build the teeth off the dental implant and the abutment.
Wow. Now, you mentioned about making the mold. So what goes on in that part?
So these pictures are showing what we have is the young man where we take a model of his mouth. And so these are impressions that will make a model of the upper arch and the lower arch, not only the area of concern, but the adjacent areas, because the surrounding teeth impact also the missing areas. So, and that allows us to help establish his bite to make sure that when we reconstruct him, not only reconstructing bone and the smile, but we're also trying to get his bite right. So what we're doing here is my assistant is making a model, and then we'll pour up some stone models. So basically it's an exact replica of the patient without the patient being here. So, and then the other team member is the dental lab, and then we get the lab involved, and then they can start making teeth that will fit the missing tooth situation.
Dr. Livesay, thank you very much. Stay with us when we find out what happens with that mold next. Now we're with the second part of the puzzle, where the abutment and the crown is going to be made. With me is Chris Morris from ADL Dental Lab.
How are
Chris,
you?
thanks for being with us.
My
today.
pleasure.
Now, tell me, what is your role in returning the smile to James?
Well, we are the tooth cobblers. So we actually fabricate the restoration that Dr. Siegel will be placing in the mouth for the patient.
Now, so we saw earlier how a mold is made.
Correct.
And what do? You take that mold and do what with that?
We'll take that mold and make a model. So we take the impression that the GP or the doctor has made for us, and we'll pour up a stone model or a cast, and then that's a representation of the patient's mouth.
Okay.
And from that, we will make the restoration that the doctor has prescribed for his individual patient. So whether it be an implant or a crown or a bridge or a denture, whatever the restoration is going to be, we fabricate that for the doctor.
So you make this thing from scratch?
We do. It's all handmade.
All handmade.
It's a little piece of art.
And that's the sort of thing that's going on here at your shop right now?
That is correct. That is correct.
What are some of the things that we're going to be looking at here? So I see people working with their various high-speed drills and all that. So what do they start with the mold of the individual's thing, or do you have a standard that you try to
No, there's no standard. Everything is all custom made, so it's made per the individual patient. So we don't make a widget here. We actually make the individual teeth or the individual prosthesis for the patient. So it's all custom made and custom fabricated. So we'll start from the model and then work the various procedures all the way through.
Do you have to work closely with the dentist that's working with the patient?
Hand in hand. I mean, it's a partnership, so it's a strict partnership.
So you take things back, then they'll send it back for you to refine it, or how does that
If
work?
need be, they don't like it too much when that happens. They like it to go in right the first time. So if that happens, we'll make any little refinement or adjustments to it and then send it back to them for the patient's approval or finally the doctor's approval.
Now, what are the different pieces that you'll make then? You refer to the abutment? And what
Well,
is that
the
part?
implant abutment would be on top of the implant. So the implant would be in the bone and be integrated into the bone, and then the abutment would actually replicate the tooth.
Wow.
So where a missing tooth is there, the abutment replicates that missing tooth.
How do you match up the color?
Well, that's an art too. You know, it's not like going to Lowe's and getting a paint chip. So we actually take the prescription from the doctor, and he will give us a shade. There are various different shades. They're not one standard shade. So he'll give us a shade, or we'll see the patient here again with the doctor approval, and we'll match the shade with either a camera or a custom shade chart that we have. But again, it's not a one size fits all. Not like buying a pair of brown shoes. It's a custom piece.
Now, I must admit, I'm impressed by your technicians here. They seem to be using some of the same tools that I see the dentist using whenever I go to their office.
Absolutely. They're just not in the mouth. So, no, we use high-speed hand pieces and hand drills and those kind of things, and brushes to stack porcelain to make the individual pieces. So we use the same thing, just not in the mouth.
So you mentioned porcelain. What other materials are you working with here?
Metals, zirconia, gold, titanium. There's a plethora of materials that we use, but what you see on the outside is the porcelain or the zirconia type of material. Unless it's a full gold crown, then you would see obviously the gold color or the gold metal.
I see. Now, how strong is this material?
It's not as strong as a God-given tooth, but it's strong enough to be very durable in the mouth. It's going to, along with good maintenance and good oral hygiene, it's going to last the patient's lifetime.
So again, the usual brushing, things
Absolutely,
like that.
absolutely.
Nothing, no other special care that they have to do when they have this.
You don't want to chew on ice cubes.
But they're always so tasty.
I agree.
Finally, how do these people train to do this?
A lot of them are, they're skilled technicians, so they're, it's not something that somebody can just sit down and start doing. So they've either on-the-job training, they've gone to school for it, an associate's degree, they've learned, here through different CE or continuing education programs that we've had. So again, they're artisans within their task, and they're very skilled at what they do, and so they take it very personal. They're actually making a body prosthetic. It's not just making a widget that's going to ship in a box. It's going to be something that they make. They put time and care into to go into a patient's mouth. So they take a lot of care and time into it.
Well, stay with us as we see what happens when we go from ADL Dental Labs to Dr. Siegel's office when we see how the tooth that has been made is put back into James.
Okay, so what we have here is the impression that the doctor sends in. He's taken this of the patient, of the preparation that he's done in the mouth. He's taken, it's a polyvinyl siloxane material, and he's taken the impression of the tooth. From that, we pour up a stone model. This is the stone that we use. There's the prep that the doctor has done, and he's cut the tooth down in order to accept a crown that he's prescribing us to make. He's also taken a bite registration and an opposing model, which is the patient's upper teeth in this case, and this is a very good doctor we work with. He took a full arch case. He can also take what's called a quadrant, which is the same kind of thing, except he's used just the quad, or just the section of the mouth that we're restoring, which is one tooth here. So this is what the doctor would send to us. It's disinfected in our process and then sent into our model room, which then proceeds to make the model. And from there, we have a cast, which we showed, a full arch cast here. This is a quadrant cast. Here's the tooth that's being replaced or restored. And this is the little articulator that we would use in order to simulate the jaw function to make the single tooth crown. This is actually an abutment. So this is actually the implant abutment that Sean has already scanned and designed here. That's it right there. We can make it bigger, and he's marked the margin, which is what these green dots are, is he's marked the margin on there so we can see how it comes together. Okay, so what we've done here is we've digitized the model that you saw in the model department, and we've made a CAD version of that or a digital model of that in our computer here, and we are able to design the crown and to trim the die and design the crown all in 3D and CAD. And then that is sent to a milling facility that actually will mill the crown or a coping for us to adhere the porcelain to veneer it and put porcelain on it, or to glaze it if it's a full contour zirconia type of restoration, to go ahead and glaze it here in the laboratory. So this is the new generation, or the next generation of the dental technicians is in the CAD operator.
Now we're with the final piece of the puzzle as we try to bring the smile back to James. We're with Dr. Martin A. Siegel, a general dentist who's also a prosthodontist.
Yes, sir.
Dr. Siegel.
Nice to be with you.
Thank you for being here. Tell me now, what is it that you do here in this practice?
I'm a general dentist, and I received my specialty certificate from the University of Louisville School of Dentistry in prosthodontics, which is the specialty of aesthetic implant reconstructive dentistry. In this particular practice, we're a family practice, treat all kinds of people, and within that we have our subspecialty of prosthodontics, aesthetic implant reconstructive dentistry.
So that's what prosthodontics means?
Yes,
the
sir.
Aesthetic bit. So what is your role in this whole process now?
Well, we begin actually in the first stage. Dr. Livesay and I look at James's x-rays and CT scans, and we plan where we'd like to place the implants. And my role is at the finish to take those implants and put nice crowns on top of them, and for James to also place a bridge on the lower. Now,
here we see a nice picture of, I guess, is your colleague who's examining James.
Yes.
What is she's doing here now?
That's Dr. Perry, who has a wealth of experience in implants, and she is helping Dr. Livesay and myself and Chris Morse in looking at James and providing us with a diagnosis.
Okay, so at this point, once you've done that, now, what is your next step that you're going to be doing here at this point?
Well, we have our implants placed already, so we have to reproduce the position of the implant that's in James' mouth in our laboratory. So I take an impression of that implant, take it back, make a model, is something like this. As you can see, we have implants, and then I make a crown to fit on top of this implant. So he has a new root, and he has a new tooth.
Wow. Now, how does all that, I guess, get put back together again? When we look at a picture like this, is that what we're seeing from the inside of his mouth at this point?
What you're seeing at this point is the surgery has been completed, and those are healing abutments.
Okay.
Because you're going to wait about 2-3 months prior to me constructing the crowns for James.
All right. So then when we look then at this picture, what is it we're seeing here?
You're seeing the healing abutment unscrewed and the actual implant. And another model will show, this is a model of an implant in where a patient did not have a space. And here is the part that I'm going to make.
I see.
So the crown can sit on.
So then this is what you're actually going to fit down. So when we look at this picture, is that what we're seeing, where the actual crown is sitting down into the patient?
That is the final, where the crown is, in this particular case, screwed in, and then we'll put a filling in those little holes to make it look perfect.
So it literally is screwed down in there.
It can either be cemented or screwed. And we chose screw retained for James.
Now, I know that you did some x-rays.
Yes.
What is it that we're looking at when we're seeing this x-ray here?
Well, in order to take the implant placed in James' mouth and reproduce it exactly in our laboratory, we have to take an impression. So on this particular x-ray, that's our impression copings.
I see.
Okay, so I'm verifying that I have a seated, confirmed position, because inside the implant, it's an 8-sided figure.
No, really?
That's how you're able to have an implant that is seated without any rotation.
So it's almost as though I guess the carpenters always say, measure twice, cut once. But it looks like you're going through a process where you're fitting, taking out fitting, measuring. How many times do you do that?
I'm always verifying position, because if the position is off an eighth of a turn, the implant won't fit. Or if you try and put it in, you'll overload the implant. You don't want to do that. So I'm always verifying.
Suppose you can't get an implant in, or I guess what would be the circumstances where an implant would not be appropriate for a patient?
Well, there's different, as you know, there's different qualities of bone in different areas of the mouth, and we need a certain length and width of bone to place a nice size implant, a nice diameter, width, and length. And if we don't have that, we can graft some bone to add some width.
And if you can't get the bone in there or the graft doesn't work, what are your options in for filling that space, as we have in this case where you have that gap in the front?
We're going to finish this young man, because we don't have those options, with a fixed bridge. And again, another model is a demonstration. This is actually a fixed bridge. We take the teeth. See, he's missing teeth.
Yes.
Repair those, cement this on permanently, and he'll be extraordinarily happy.
Now, you said a fixed bridge.
Yes.
So I assume that there's a
removable prosthesis, but when it's removable, it's not as comfortable, and it's a little bit more of a hassle for a patient. So I think we can do a very nice fixed bridge for him and make him very happy.
Now, having one of these, can a person do all the normal things with their teeth?
Normal things.
Eat corn on the cob and all that?
Eat corn on the cob, have an apple, go out, smile, have a great life.
This has been a rather, from my perspective, just looking at what you all are doing, this whole process, it's got to bring great joy to you, but boy, it's a lot of work to go through.
It's a lot of work. It's what we love to do. I actually practiced for 11 years as a general dentist and found the niche of prosthodontics and went back and did a 2-year residency with my wife supporting me. I have the best wife, I have to say that. And
we'll let that stay in.
We'll let that stay in. And it does give great joy to restore form and function.
So as you look at this final process as this team, you're the finishing carpenter?
I like to think I'm the finishing carpenter, and I'm the beginning carpenter. I think you need a quarterback. I think you need a plan. And I know where I want to be at the end, so I can help at the beginning.
And so that's the way it works.
Yes.
This is a very good team that you have.
We have a great team. I'm really pleased.
Well, Dr. Siegel, I'd like to thank you very much for letting us come out here to your practice
My
today
pleasure.
and to talk to you about this. I mean, there's so much. I sure hope that if any of you have any problems regarding your teeth, particularly if they get knocked out or if they're bad, you have to have extractions, that you don't delay. See someone soon, and then hopefully you'll get into the good hands of someone like Dr. Siegel, Dr. Livesay, and the good folks down at the lab with Mr. Morris. Thank you very much for being with us on this segment of Kentucky Health. I wish you all good smiling and, please, good oral health.
Where the Appalachian Mountains rise in the east, Lord, it gives this weary soul some peace. Corvettes and gold cars, the river flows, Loretta, Linda, Bill, Monroe. Barbecue, burgoo, and bourbon balls, from the land between the lakes to the Cumberland Falls. There ain't nothing like my old Kentucky home, so weep no more as I sing this song. I got the Commonwealth where the sun shines bright, in my bluegrass state of mind. See you from Kentucky to now do you bleed red? riverboats from the Osborns to the Goldens. Barbecue